Well, good morning, good afternoon, good evening. I'm Dr. Cherryl C. Burks, your Citizen Engagement Specialist for Spalding County. Can you believe we're here at the end of September, getting ready to march into October? Now, many things have transpired during the year I've been your Citizen Engagement Specialist that afforded me the opportunity to talk to you about some things on the lighter side. Um, that will impact the quality of our lives here in Spalding County, such as the road resurfacing project, the listening tour for Spalding County, information about the regional airport, the data center, and even the repairing of the cupola. And I really love saying cupola. But today I want to talk to you about something that's a little bit more serious. Did you all know that September was designated as the World Suicide Prevention Month, as well as the National Emergency Preparedness Month? Now, I bring that to your attention because here in the state of Georgia, and especially in Spalding County, we have some staggering statistics dealing with our public health and mental wellness that affects our citizens in so many ways, be it depression, bipolar, substance abuse, anxiety. These things are very real and very prevalent in our community. Let me start with the state of Georgia. Over 1.8 million adults in Georgia live with a mental health condition. 76% of counties are designated in Georgia as mental health professional shortage areas. Suicide is the second leading cause of death in Georgians between the ages of 10 and 34. And youth mental health emergency visits have increased 163% since 2019. Only 41% of adults with mental health illnesses receive treatment. That's staggering. That is so staggering. Now let's put it on Spalding County. In Spalding County, there are 641 residents for every mental health care provider in Spalding County. Residents report an average of 5.6 poor mental health days per month, which reflects emotional distress, mental health challenges. And get this, 17% of Spalding County residents lack health insurance, which can be a barrier to accessing mental health services. Now, all is not lost, but I want to focus in just a little bit more. I want to drill down on some things that have occurred in our community with our public safety employees. There are many of them who, on an everyday basis, have to deal with things that really impact the quality of life of some of our citizens who call 911, who have emergencies that sometimes are not necessarily dealing with the physical part, but the mental part. And this brings me to this. Some of our firefighters, I was told by one directly, sometimes when they get those calls, there are more mental health calls that they have to respond to than they do putting out fires. Now, again, all is not lost because we have many resources here available in Spalding County. You can work with the Spalding Collaborative. They have developed a resource guide. It's quick. You just one click away in any type of services that you may need, be it dealing with food insecurities, mental health, physical health. There are resources in our community that we can access immediately to get help. Also, you can call 988 mental health emergency services, which are available 24/7. We have local initiative that the Spalding County Behavioral Health Committee has been formed to help address those needs. But the biggest thing we could do is talk to each other, talk to our children, talk to our families, talk to our spouses, talk to our neighbors, take an interest, because sometimes there are things that we can see and we can have a conversation with them that can possibly talk them down from making a permanent solution to a temporary situation. Again, I hope you understand what I'm saying. So when we encounter our community members who may be struggling mentally, we need to be able to say unashamedly and embracing them to say, you know what, you're not alone. So again, I want you to take the time to get to know your neighbor and begin to research some things for yourself to make sure that our citizens are taken care of, be it our public safety who deals with this in real time, having them to have information about programs that are available statewide for them, and also for those, our citizens, our average Joe Blow, to be able to say, you know what, I can call 988 and I can get some help. or 911 if you can't remember 988. So hear me with your heart and your ears to say, I am the I in Spalding, and I definitely want to be there for my community. Again, I'm Dr. Cherryl C. Burks, your Citizen Engagement Specialist. You all have a nice day, and let's get ready to march into October with optimism, help, and resources. Bye-bye.